The term atrial cardiomyopathy was used initially in 1972 to describe familial atrial cardiomyopathy with heart block and later atrial standstill. In 1997, the concept of tachycardia induced atrial cardiomyopathy in atrial fibrillation was suggested. Electrophysiological and anatomic remodeling of the atria were considered part of atrial cardiomyopathy, which led to maintenance of atrial fibrillation. Fibrotic atrial cardiomyopathy was proposed as specific disease or syndrome supplying substrates for atrial fibrillation, atrial tachycardia, dual nodal disease, and thromboembolic complications in 2012. The author cited the concept of AF begets AF, which was considered to be the result of tachycardia-induced atrial remodeling. It was also suggested that the so-called lone AF may have an undetected chronic substrate. Atrial fibrosis correlates with persistence and burden of atrial fibrillation. Gadolinium-enhanced magnetic resonance imaging may be used to detect and quantify atrial fibrotic substrate, though with some limitations. Presence of an atrial substrate has also been invoked by the fact that popular scores incompletely account for thromboembolic risk. It is also known that stroke can occur in patients with AF even after sinus rhythm is restored. A multi-society expert consensus statement on atrial cardiomyopathy was published in 2016. A review in 2017 asked whether atrial cardiomyopathy is a useful notion in cardiac disease management or just a passing fad. They noted the paucity of citations on Medline, just 39 at the time, suggesting limited use of the term. As on date, a PubMed search on atrial cardiomyopathy has just 181 results. Still, there is an article in 2021 describing atrial cardiomyopathy as an emerging cause for embolic stroke of undetermined source. The 2020 EACTS guidelines caution us that withholding oral anticoagulants after left atrial appendage occlusion is likely to result in under-treating the overall risk of stroke related to atrial cardiomyopathy. The guidelines also mention the role of drugs which affect the atrial remodeling process in prevention of new onset atrial fibrillation, acting as non-conventional antiarrhythmic drugs termed as upstream therapy. The drug groups included as upstream therapy were angiotensin converting enzyme inhibitors, angiotensin receptor blockers, mineralocorticoid receptor antagonists, beta blockers, and statins. But the evidence is not convincing in most cases. The risk factors in the scoring systems used to assess thromboembolic risk in atrial fibrillation are also causes for atrial disease or cardiomyopathy. It is possible that the presence and type of atrial cardiomyopathy is an independent predictor of stroke in patients with atrial fibrillation. First set of journal references on atrial cardiomyopathy. Second set of references. Third set of references. One more reference. Thank you for watching this video. Please subscribe, like, share, and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.